So today's been a celebration of a report into a set of roles which really help people connect with their community. Some of them are social prescribers, health and wellbeing coaches, link workers of different kinds, and they play a really key part of North Cumbria's health and wellbeing system, really, because we have loads of fantastic voluntary sector organisations, loads of community groups, but it can be a real challenge for a lot of people to access those, to know they're there even, but then to get the courage to leave the house and go to one of those groups can be really hard. And that's where these roles come in. They can really stand alongside somebody, encourage them, empower them to get to these events and groups that can really make a massive difference to their lives, transform their lives. The report itself, Passion, Connection and Community, and it's a celebration of social prescribing type approaches in North Cumbria, really focusing on how we're doing things really well in North Cumbria. There are some amazing projects, some amazing work going on. We're often used to being thought of as kind of catching up with national and bigger cities, but actually we're being celebrated as being really far on and right at the forefront of this work. Hopefully people take away that pride in the work that they're doing and in the help that they're giving people. But then I also hope that we secure these roles and we secure more sustainable funding, especially for the voluntary sector in North Cumbria, because that is really challenging and the vital support can easily disappear. So I suppose it's about making that pitch for continuing this work. We've got 8 stories in this report of Cumbrian people who've gone through really challenging times in their lives that they've been supported through by one of these workers and then supported to access ongoing support in the community. We know that primary care, so GPs, general practice, they're under a lot of pressure at the moment. You know, there's a real challenge for them in terms of how they meet the needs of their population. In Cumbria, we do have an ageing population, so that need can be even greater. What we've found in this report is that whilst obviously clinical interventions, medication, tablets, hospital care is really important for some people, there is a real value in that approach of finding out what's important to someone, finding out what they love, what makes them get up in the morning, what they have a real passion for, and connecting them to that in the community can have a real transformational impact on them. Or it might be that they need a bit of support in terms of housing or benefits or all kinds of different things that might lead to somebody going to a GP surgery to see their GP, but actually the problem can be solved much earlier on or with an approach that doesn't need that clinical setting.